If your surgery is tomorrow, there are a few important things you should do tonight to make your surgery safer and your recovery smoother. Please take note of these 7 important points to ensure safe preparation before your surgery. First, follow all fasting instructions. Second, have your ride home. And fourth, bring your ID and paperwork. Your healthcare team will usually give instructions about when to stop eating and drinking before surgery. This is important because food or liquids in the stomach during anesthesia can increase the risk of complications. Most patients are asked to stop eating several hours before surgery, but the exact timing may vary depending on the procedure and anesthesia type. If you are unsure about your instructions, it's always best to confirm with your healthcare team before the day of surgery. Many hospitals recommend taking a shower the night before or the morning of surgery. This helps reduce bacteria on the skin and lowers the risk of infection. Sometimes you may be given a specific antiseptic soap or body wash to use, mostly before joint surgeries or surgical procedures involving implants. If so, follow the instructions carefully. After using the body wash, do not apply lotions, creams, or perfumes. This is important to prevent any reactions. If you have questions, ask your doctor. Packing a few essential items ahead of time can make the day less stressful. Common items patients bring include comfortable clothing for going home, personal toiletries, and any required medications. Having everything ready the night before means you won't have to rush in the morning. So gather your important documents and your glasses or hearing aids if you need them. Your doctor may advise you to stop certain medications before surgery, especially those that affect bleeding or anesthesia. These can include some blood thinners, herbal supplements, or other medications. Never stop medications unless your healthcare team has advised you to do so. And make sure your surgical team knows all medications and supplements you are taking. Before surgery, you may be asked to remove nail polish, jewelry, makeup, and contact lenses. This allows the medical team to monitor circulation and oxygen levels accurately and helps maintain a safe surgical environment. It also reduces the risk of items being lost during your hospital stay. If you are returning home after surgery, it can help to prepare your environment in advance. Simple things like arranging comfortable resting areas, preparing easy meals, placing essentials within easy reach. Organizing help from family or friends can make your recovery period more comfortable. It's very common to feel anxious the night before surgery. Some patients find it helpful to try calming techniques such as slow breathing exercises, listening to relaxing music. Avoiding stressful internet searches about surgery and getting enough rest can help your body and mind feel more prepared for the procedure. Understanding what to do the night before surgery can help you feel more confident and prepared for the day ahead. I share helpful information about surgery preparation, operating room procedures, recovery expectations. If you found this video helpful, please like and subscribe for more practical patient education.